Do we have the chest X-ray?
Yes, Dr. Turner.
Sure.
His sodium is 123. I was wondering if his hyponatremia might be due to a syndrome of inappropriate ADH secretion. Do you think it might be due to
Mitotic lesion, yes. Let's see what's thrown up in the pleural aspirate.
No, we should check plasma and urine osmonalities if we're suspecting it's IDH.
By the way, was that you I saw the other day having a knock in the nets at the medical school?
Could have been, yeah.
Well, you want to use your feet more, you know, get to the pitch of the ball, there. Huh? Oh, I should talk. I was more of a bowler, really. Medium pace over the wicket. Though now it's more snail's pace over the hill.
Perhaps if we get the weather again, the consultants would like to take on the juniors one weekend.
What a marvellous idea. Do you play the beautiful game, Andrew?
No, I never really
Oh, dear, never mind. Do you smoke, sir?
Oh, no. Gave it up this morning.
But you've been losing a bit of weight recently.
Well, I think I have,
You
yes.
mustn't forget to culture for tubercle, though the most likely pathology is neoplastic, isn't it?
Hey, yeah, what's the verdict like?
We're doing some more tests, sir, and we'll have a good idea soon. Good man. That's all, isn't it, today?
Yep, that's it.
Actually, Andrew, I want a word before I go. I've been asked to inform you that from now on, when you're on call, you're to cover ENT.
Dr. Turner, on top of the fact that, as RMO, I'm busy enough, I've never done any ENT.
A reluctance to accept responsibility does not dispose one's seniors towards providing a favourable reference, Andrew.
But I am not trained for it.
No one wants to have the reputation as a troublemaker.
There's a line being drawn for me. Cross it one more time and there'll be a poster in every hospital saying, "Do not employ this man." This is Dr. Collin, hello. Oh, hi, Alison. No, I'm on tape tonight. Well, I think I did tell you. Oh, it's not going to make any difference. Just hang on.
Can you do a form for this MSU, please, Andrew?
Yeah.
Is that your wife again?
Yeah. Alison's concerned I'm not showing enough commitment to church activities.
Fascinating.
His powerful hand unbuttoned her blouse, which clung to her ripe breasts. "I don't care about your flash Maxter Narm," she husked. "Take me now, Chuck." When he finally entered her...
Dr. Maitland,
Yes?
are you aware that Dr. Yates' outpatient clinic started over an hour ago? Maybe you could hand this case to another doctor so you might attend.
I think doctors on call for emergencies should be excused routine duties. Can't be in two places at once.
Well, what I wanted to bring to your attention is that without your contribution, patients are going to be kept waiting. As you well know, we are committed to seeing patients within 15 minutes of their appointed time.
I'm committed here. $30.2.
Yes. Clear.
Nothing.
We'll cook his heart this way.
Continue rewarming and shock every half an hour?
Sounds sensible to me.
I'm afraid I've arranged to see one of my private patients this evening, but I'll be available on my mobile should you need me. I've told the family have finally been tracked down. Just enough time to speak with them. Perhaps now would be a good time to hand over to the on-call team so that you can get off home.
Thanks, Dr. Turner.
Do you hand over to first or second on?
We're staying.
Yeah, of course we are.
At low temperatures, the heart is relatively unresponsive to drugs or electrical stimulation, so we can only give supportive treatment until your son's body temperature increases.
After being like this for so long, isn't there a risk of brain damage?
Hypothermia results in a relatively low metabolic demand, so the likelihood of lasting damage is much reduced. But at the moment, we can't say how things will go.
It really is far too early to say.
We understand. Thank you so much for everything you're doing.
That's what we're here for.
How are your eyes now?
Oh, no problem at all, thank you, Doctor.
Good. Alf, thought I might have a quick word.
Far away, Doc.
So we didn't get a chance to talk to you properly earlier. Never get a chance to talk to anyone in this job. Someone always reminds you that every minute you spend with one patient is a minute longer you keep the next one waiting.
Don't worry about it, lad. I know what you're on about. Just as I knew that first doctor put the needle in the wrong side. Well, I'm not as daft as I look, the nose. Well, he'd been up all night. He seemed a decent enough fella, and I didn't want to cause any trouble for him.
I just wanted to confirm what you suspect already. The most likely cause of your problems is lung cancer.
Thought so.
Well, there's a chance it could be something else. There's some tests that need to be done, but...
Well, you do what you have to do, son. I'm not going anywhere.
OK. I'll see you, Alf.
Oh, I see you, Doc.
Just the, My secretary passed on your letter regarding your application for the, Still, I'd be happy to provide you with a reference.
Thank you, Mr. Docherty.
Keep it to yourself, my boy. Otherwise, all the no-hopers will be beating a path to my door.
Dr. Yates, you're not on tonight, are you?
Well, I guess H.O. can find something to do when she should be at home. I'm sure I can't do. I'll bet Graham Turner won't mind the old buffer looking after the shop. Now then, what's this young fella's temperature doing?
33, wasn't it?
200s.
Clear. Clear.
When are the interviews for that registrar's post at the General?
Didn't apply for it.
Graham Turner seemed convinced you'd dance it.
More long hours. Some poxy research project of absolutely no importance whatsoever. There's no climbing out of this cesspit.
You find that as you climb the ladder, all that changes is the droppings from above get a bit warmer. Excuse me.
Look, he's been dead for 10 hours. His temperature's near normal and he hasn't come out of it yet. Do you think we can move on?
If that's what you think, then call off the resuscitation. Just say stop and sign your name in the notes.
It's not my responsibility.
Exactly. It's easy to make decisions when you don't have to carry the can. I have to. Every day.
If there's no joining out, maybe we should think about stopping.
We carry on.
Hold it. Son, it's Brady. Good output on that.
Time for the old buffer to fade away.
Our lad's trying to breathe on his own now.
Best see if there's an ITU bed just in case anyway.
Must be joking. It's full of Bosnians out there.
Well, as you know, we've been working very hard for quite a few hours now. And...
I'm supposed to be meeting some of the lads for a drink. You're welcome to come, Claire.
Maybe next time.
And I think he's going to pull
He's
through.
going to be all right.
Yes, he's going to be all right. He'll pull through. Yes, I'm sure of that.
That's good.
It's all right. It's all right. It's all part of our job. No.
Actually, James, maybe open.